Hello, everybody. We are back again to our hashtag Holistic Health Initiative 2025, baby. Boo, 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 boo. And we are on the month of October, and as usual, I am wearing myself. This is the October edition. If you are interested, hi, dog. Yes, I see you, dog. Okay, let me just finish my intro, then I'll add you. If you're interested in learning how to make them, or you just want to buy a pair, just type Beacon of Light Craft on every social media platform and we'll take it from there. So since we're on the month of October, we are going to be discussing hashtag breast and mental health, and today's topic is breast cancer awareness. And our guest is the pizzazz, the cutesy, the one and only Dr. Richa Dawar. I'm already seeing her here. Welcome, Doc. I'm inviting you. Please accept the invite. All right. So while we wait for our guest to join, amazing. Our guest is here.
Yes, I'm
Okay,
here.
Doc. Please
Hi,
allow
finally I'm here.
what you call video
Can you hear
thingy.
me?
Yes.
Yes.
Beautiful.
Great.
Hi,
Okay.
Doc. Boo, boo,
Hi,
boo,
we are here now.
boo. I think your mic is muted, dog. Is it mute?
Yes. Okay. Let
Okay,
me.
perfect. Oh, it was my volume. It was my volume. Forgive me, dog. How
Okay.
are you,
No, it's
dog?
okay. Good. Finally, we are here. Okay, great. Thank you so much for having me. This is amazing. And thank you so much what you do. I'm really like impressed by what you do, your page, and how you help other people and patients. It's amazing. And I think that we need more people like you.
Oh, thank you, dog. Thank you. Amazing. I'm blushing. Thank you, dog. So, dog, today we are talking breast cancer awareness. So, can you please introduce yourself and tell us why you are worthy to be cooking us today? So, yeah, over to you,
Yes.
doc.
Sure. So for everyone who don't know me, I'm a medical oncologist. And what does it mean? I'm a cancer specialist. I specialize in breast cancer and lung cancer, and I am in Miami. I practice at University of Miami, which is a big tertiary center in the Miami. We are NCI designated cancer center, and I do a lot of research for cancer patients. And because we just went past October and October is a breast cancer awareness month, let's talk about something about breast cancer. However, I feel that why do we dedicate only 1 month for breast cancer, right? I don't understand this. I think that every year, every day, we should talk about breast cancer, and it should not be just dedicated for just 1 month. But because it's like October, we need to talk about, okay, so here we are. So I'm here, I'm here to help everybody. And we're not going to talk medical language. We're going to talk simple, common language, which you all can understand. And I know what my patients ask me. So I'm going to go over that. And if you have any questions, you can ask me in between. So maybe we can proceed with that. So before we start and before we talk about why do we talk about breast cancer, right? Why do we need to talk about it? And why do we have breast cancer awareness month? It's very important. Why? Because breast cancer affects 1 in 8 women in United States. And that's a lot, which means that over a lifetime, imagine that for every 8 women, one of you out of 8. So if you have, I tell my patient, if you have 8 friends, out of 8 friends, one of you will get breast cancer. I mean, that's really high. And if you talk about Ashkenazi Jews, which I also talk about because they have a greater risk. So Ashkenazi Jews are important because they have a higher risk of having a BRCA mutation. So BRCA mutation is a gene which can cause breast cancer, ovarian cancer, and generally in our population, we have 1 in 400. So one person out of 400 will have BRCA gene, but if you're an Ashkenazi Jew, you will have 1 in 40. So that's high. So it's important to know the risk. It's important to know why we are looking at breast cancer. It's important to know why we need to talk about screening because it can save life. And we'll talk about some things that my patients tell me, what's true, what's not. So busting the myth and the facts, right? So before we talk about myths, very important to know breast cancer is the most common cancer in women, excluding skin cancer. And men can get breast cancer too. So anybody who has breast can get breast cancer. So it's not just a disease of women, it's a disease of men as well. It's just that men have low incidence, like 1%, but it can happen. Number two, very important, my patients tell me, oh, I don't have anybody in my family with breast cancer, so I won't get it. No, 85% of breast cancer occurs with no family history. That's a pretty high number. 85%, yes. So that's why it's important. So doesn't mean if you don't have a family history, doesn't mean that you are at not risk, because 85% of the breast cancer can happen with no family history. So why it's important, screening is important for everybody, whether you are at risk or whether you are at high risk. If you are at high risk, we'll talk about it later, and we can talk about what things you can do in addition to mammogram. Myth number two, patients come and tell me, oh, I'm negative for BRCA gene, so I'm not at risk. No, BRCA mutations only account for 5 to 10% of the cases. That's it. There are other genes responsible like CHEK2, ADM, P53, lots of mutations which are responsible for breast cancer. So it's very important. Yes, if you have a family history, you go to your doctor. Now we have genetic testing available that we can get tested. Yes, I saw the comment, it's the food we eat. Exactly. So it's not just the genes, it's whatever is happening in our environment. So the cancer can be genetic or it can be environmental. Environmental means anything in the environment, what you're drinking, what you're eating. And sometimes, even if you're doing everything right, I have so many patients who are eating healthy, who are not eating red meat, who are exercising every day. They're living in we cannot avoid the air, right? But they're still getting cancer. So the answer is that there are some reasons we don't know why this is happening to us. But if it's happening, we need to do screening, prevent cancer, and save lives. Next, then patients tell me, oh, I check myself every day. I don't feel any lump in my breast, so I'm fine. I don't need screening. No, not all breast cancers come with a lump. Not all breast cancers form a lump. So patients ask me, what are the most common signs and symptoms that they should look for breast cancer? Skin changes over your breast, any skin changes, skin redness or skin turning different color, or a nipple discharge, nipple changes, persistent pain, or a lump. So there are more symptoms, not just lump. And I tell my patients all the time that it's important to know what's normal for you. So you know your body best, right? We know our body best. Like, for example, I know my body best. My doctor doesn't. So if you feel that something is wrong with your body, speak up. Speak up, stand up for yourself, go to your doctor. If that doctor is not listening to you, go to somebody else. But you need to stand up for yourself and get something checked, right? Next one, patients ask me, very, very common. Mammograms are dangerous. They can cause radiation exposure, and radiation can cause cancer. And then they tell me, oh, that person got cancer because she was getting mammogram. No, let me tell you, mammograms use a very, very small dose of radiation. People don't even know that when you're watching TV, you can get radiation exposure. You don't even know, you don't even know that walking and just living in this world can cause you radiation exposure. Like, for example, if you take a flight to Europe, if you fly and take a transatlantic flight, you're getting radiation exposure as same as mammogram or more than mammogram. So tell me about it. Mammogram is safer than flying to Europe. So skipping screening is very risky, very important to get your mammograms, and we'll talk about the guidelines, the age, and everything. Next myth, very common, patients ask me, young women don't get cancer. It's a cancer of old people. No. Nowadays, more and more patients are getting cancer at a young age. We don't know the reason. Yes, a lot of things has to do environmental. We know that. Modernization, as somebody mentioned in the comment. Yes, exactly. Combination of modern elements. It's a modern issue. It's a disease of westernization. 50 years ago, we did not know cancer. There was nobody with cancer. And now, like, every household has a person with cancer, right? So young women can also develop cancer, and it's not just old women. So, and especially if you have a strong family history, so get tested. Next one. they tell me, okay, I got mastectomy, I got my breast removed, so my cancer won't come back. Wrong. No surgery or treatment guarantees zero recurrence. Even if you get the breast surgery, even with the chemotherapy, your risk never goes back to zero. What actually prevents, not mastectomy, even after removing the breast cancer can still come back. So what helps to prevent the cancer from coming back? Healthy living. Follow up with your doctor. Additional treatments which doctor can discuss with you what you will get. Certain treatments, certain pills, certain chemotherapies can help prevent the cancer from coming back. Then the other myth which I get, patients tell me, if I have breast cancer, I definitely need chemo. So I'm so scared of chemotherapy, and chemotherapy can kill me. I saw my friend and she died after chemo. Understand that every cancer has different chemotherapy. When we say chemotherapy, it's not just one drug. There are hundreds kinds of chemotherapy. That's why you have an oncologist. So you go to your oncologist, you discuss with them, and now we make a personalized, individualized plan for every patient. So it's not like one plan fits all. So what treatment I'm giving it to one patient doesn't mean I'll give it to you the same. The oncologist would take into account the age, your comorbidities, how healthy you are, how active you are, what other medical conditions you have. All those things are very important. Nowadays, chemotherapy is very, very tolerable. And with the chemotherapy, you can actually lead a normal life. You can work. I have patients who's a teacher in school, and she couldn't take days off because she needs to work. She has insurance tied to her work. So she kept working every single day. So just because you hear the word chemo, don't be scared. There are ways to decrease the dose of the chemotherapy. Talk to your oncologist about it. Also, very important for breast cancer patients, not all breast cancer patients needs chemotherapy. There is one type of breast cancer which is hormone positive, estrogen positive breast cancer. If you have that, your doctor can do a test and that can decide if you need chemotherapy or not. And that was a big breakthrough that we received in breast cancer. So discuss with your oncologist for sure. Then patients often ask me, oh, I don't need to go for screening because I have no family history and I eat healthy, I live healthy, so I won't get it. Wrong. Healthy habits reduce the risk, but do not eliminate it. Lifestyle matters, but screening and genetics and environmental role play a huge, huge role in it. So we talked about the myths, the facts, and now I'm going to talk about the screening, because you must be wondering, okay, do I need screening? I'm talking about, okay, everyone should get it, but what is the age? So according to our screening guidelines, for average risk women, like if you don't have any family history, if you don't have any high risk, you should start doing screening mammograms once a year at the age of 40. Very important. However, if you have anybody in the family who has breast cancer, number one, if you had any breast biopsies in the past, number three, if you had any breast condition such as atypical hyperplasia or hyperplasia of breast, and number four, if you have a BRCA mutation or any other genetic mutation, you are at high risk. If you are at high risk, then you need screening before 40. At the age of 25 to 30, you start your screening, and in your case, the screening will be with MRI also. So we do mammograms and MRI. Then there are certain tablets that we can give it to our patients that you can take, like pills, like tamoxifen, which can prevent breast cancer. Patients who have a higher risk of breast cancer, like more than 20%, and there are calculators that we can use in the clinics to calculate your risk of breast cancer. So that's really, really important. So the takeaway, and then we can go on. If you have any questions, we can talk about it. It's important to know your family history. It's important to discuss with your doctor regarding your risk. It's important to start for screening at the age of 40. Very important, healthy lifestyle. What does it mean? Healthy lifestyle. No smoking. Alcohol has been proven to be carcinogenic. So I tell my patients, limit alcohol intake. Physical activity, very important. Stay informed. Go to your doctor if you're not sure. Research support systems like American Cancer Society or Breast Cancer Stay Strong, and we have lots and lots of support that we can provide to you. And I'm here, I'm here on TikTok. So I don't know, people who join now. So I recently joined TikTok just like 2 weeks ago, 3 weeks ago, and I'm so happy that I met this amazing lady who invited me to do a live program for our patients. And I'm always like, want to do something, for our patients. And the reason I joined TikTok was because I see so much of misinformation circulating out there. Patients go on Google and patients are TikToking their symptoms, and my patients sharing with me that what they find, which is actually not true. And I want to come out there and help everybody educate what's the right, correct, evidence-based information so we can bust the myths, talk about the real information. So that's why I'm here. If you need to find me, this is my name on TikTok, Richa Dawar, or it's Breast and Lung MD. But I'm happy to answer any questions you have. Okay, so there's a question about what about the GMO food we consume every day? Yes, so we always have to be conscious of what we're eating. This is very, very important. I feel that nutrition play a huge important role. So yes, watch your food, what you're eating. What I do, I always read my label. Just because something says organic, clean, doesn't mean it's healthy. So I look at the label, make sure there are no additional preservatives or any food colors added in it. So that will help you.
Beautiful, beautiful, wonderful, doc. Okay, I'm not seeing any other question yet. Okay, let me ask these two questions for now. Okay, the first question is, what is the risk in men, stats wise? That's the first one. And then the second one is, what do you suggest we eat and what do you suggest we avoid eating? That's the first two for now, for now.
Okay. So first, let's talk about men. Yes, men can get breast cancer too, and the incidence of breast cancer in men is 1%. So it's quite low, but they still can get breast cancer. So yes, for for male patients, we do not recommend regular screening mammograms. It's only for women. But for for men patients, if they have family history, or if they have a gene, there are some patients who have BRCA gene, so they are at risk of prostate cancer and breast cancer. So then we start doing your MRIs and mammograms in men. Second, what should we eat? What should we not eat? Very important question, which I get every single time. I'll tell you this. You can eat everything you want. Just remember one simple rule. I stay away from processed foods. No processed foods. Sometimes, yes, why not? Sometimes I've taken processed foods from the can, but I tell general rule in my mind, nothing from the can. I make everything fresh, eat everything healthy, avoid red meat if you can, because red meat has been labeled as carcinogen. So by American Cancer Society, so I would avoid that. It's okay to eat white meat, lean meat, chicken, fish. Choose organic if possible. Do not be afraid to eat sugar. Do not be afraid to eat carbs. Sugar does not feed breast cancer or any other cancer.
Okay, okay. Love it. Love it. Guys, feel free to ask questions. Feel free to ask questions, everybody. Okay, here's my other question, Doc. It's a myth. It's some sort of a myth. I need you to bust it. So, okay, it just popped up in my head just now that I feel like breast cancer was initially a woman thing. So, which means that the treatments were made in line with women, right? So, what if a man gets this cancer and then now he has to be treated? Won't his estrogen levels get heightened by this medication or treatment?
Yeah, that's a very important question, and patients wonder about it. So I'll explain to you. So, not every cancer is driven by hormones. That's a myth. It's a very important question. Yes. So, just because breast cancer happens in women doesn't mean that breast cancer is coming from female hormones. Female hormones like estrogen and progesterone. So, breast cancer is of many types. It could be hormone positive, it could be hormone negative. And then we have HER2 that will be going into detail. I don't want to bore you with that. But there's only one category of breast cancer which is sensitive to hormones. If I say hormone positive breast cancer, that doesn't mean that it's caused by hormones. It just means that it's sensitive to hormones. So in those patients, the treatment consists of drugs which can suppress the estrogen levels in your body. Even after menopause, even after 60 years or 50 years after menopause, our body, a woman's body, is still making estrogen from fat cells, not from the ovaries. There are other things also which make estrogen. So we have to suppress those estrogen level. As long as we suppress those estrogen level, you can prevent the breast cancer from coming back. So in men, if they have estrogen positive breast cancer, we still need to suppress their estrogen. So men also produce some amount of estrogen and we need to suppress that. And yes, when we are suppressing estrogen, we are also suppressing their androgens and testosterons. Yes. Sorry, you're on mute.
Sorry, Doc. I'm talking to my baby. That's why I'm on mute because wow, the chaos here. Okay, Doc. No, I think yeah, I think that answers the question. That just go for a scan, see your oncologist regularly, and then the oncologist will be the one to tell you and recommend the perfect type of treatment. So
Yes.
don't fear estrogen and all of those woo-woo things. So yeah, thanks for that, Doc. So what I am hearing from this whole thing, wow, it's a first to me. I'm blown poof. So what I'm hearing from this is we're just not safe. I mean, right now we're on TikTok, we're live on TikTok, which means that we're exposing ourselves to radiation, watching TV, radiation, flying, radiation. It's just radiation here and there. So we're just not safe. Yeah, we're just prone in every step we take each and every day. So
Right.
I don't know, Doc. I feel like can you share? Okay, go,
I
Doc.
want
Yes,
to
yes, I'm
add,
listening.
I want to add one more thing. What you said, you're right. And some people have commented here saying that, what about the food? What about this environment? What that? You know what? We cannot worry about everything we put in our body. We cannot. Otherwise, we're just going to win. We will not be able to live. And I feel that fear is one thing which will kill us. So fear can kill us too. So I am a very, very firm believer that I don't know if you believe in it, but I believe in it. I don't know what other people think who have joined. Our body listens to you. Whatever you tell your body, it listens to you. So if you tell your body, oh my god, I'm watching TV, I'm getting exposed to radiation, oh my god, I'm eating this, oh my god, they have chemicals in it. No, you have to just change your thinking, change your mindset, and talk healthy. Everything is fine, everything is okay, I'm doing whatever I can the best for me. That's it. And just leave it up to whatever it happens.
True. Amazing. Change your mindset. It's all controlled by the mindset. I mean, yeah, I love it, Doc. But I needed you to share a real life success story, a story of somebody maybe who had cancer and beat it, like something like that. Yeah, just to motivate us and just eradicate the fear. Yes,
Yes,
yes, yes.
yes. I have so many patients, and maybe one day, I can have my patient come up on the live to show them that there are some stories which are successful, they're hopeful stories. So I have a patient, amazing patient. So she was 54 when she was first diagnosed with stage 4. So stage 4 cancer is not curable. And when she was diagnosed with breast cancer, the breast cancer had spread to her spine. But if it goes to the spine, it can compress your spine. And the spine has a lot of nerves which are responsible for your movements, for your limbs, for your limbs. She couldn't walk. She was paralyzed. This is a true story. She was paralyzed. She had to go to the hospital because it was the big tumor compressing the spine. And then she had to undergo a surgery so that the pressure from the spine could be relieved. Then she did physical therapy, occupational therapy, and then her cancer is hormone positive. So hormone positive breast cancers have lots and lots of treatment options, including pills, so you don't have to do IV chemotherapies. And yesterday I saw her. It's been 10 years. She was able to attend her kids' graduation. She was able to have a grandbaby who is now 7 years old. She enjoys the baby. She's active. She exercises every day. She's a lovely grandmom, and she takes care of her grandkids. She's active. She has no problem. She's able to live her life successfully. Yes, she's stage 4. She still has cancer, but her cancer is suppressed. It's controlled. She does not have any evidence of cancer in her recent scans, and she's able to maintain it. on the medications, and she's not running out of options. She has lots and lots of options available for her. So patients need to know there are so many successful stories. Just because you have cancer doesn't mean that you're dying or you're going to die, or it's not a death sentence. Like 20, 50 years ago, yes, cancer was a death sentence, but not anymore. So do not be scared. Speak to your oncologist, discuss your options, and go for second opinion, third opinion. You don't have to stick to an oncologist. And we don't get offended. Like when my patients tell me sometimes they want to go for second opinion. Why not? You need to go and see an oncologist who can relate to you, who can talk to you. So, okay, it's a very important question. They're saying, what causes a toddler to develop cancer? Yeah, I mean, it is very, very sad, when we see our kids getting cancer. So, in kids, in toddlers, in infants who still who gets cancer, it's mostly genetic. We're talking about adult cancer here, breast cancer, which 85% of breast cancers are not genetic, but in kids, in infants, in toddlers with that stage, it's usually genetics, and kids usually have spinal cancers, spinal tumors, or leukemias and lymphomas, which have genetic component to it.
Wow. Wow. I mean, this is amazing. This is amazing. I hope you answered. I hope you answered. Who was that? Who was asking? SPM. I hope you answered. If you have a follow-up question, we're here for you. Okay. I loved the fact that you were allowed to go for a second opinion. You could be like, okay, can I go? Yeah, blah 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 blah. So yeah, be an advocate for your own body. Just don't take. Sorry, doc, I'm gonna say this out loud. Just don't take one oncologist's word for it.
I
Sake.
agree with you. I'm with you with that. And when sometimes my patients want to go for second opinion, and I have no problem. And sometimes they don't want to tell me, and they think that I'm going to get offended. And I said no, and they were like, "Why, doctor? You're not getting offended? I thought you will feel bad." I was like, "No. You know what? I encourage you. Why? Because." Let me tell you one thing. Cancer treatment, right? We have guidelines. Any doctor can give you the same treatment which I'm giving you. So go to the doctor which you can relate to, which you can talk to, which you can ask hundreds and hundreds of questions without the doctor getting frustrated, without the doctor getting irritated, because you need that kind of a doctor. So I feel that's very, very important. And when my patients, like I have a few patients who see 3 doctors and they're coming 4th time with me, and they were like, we don't know which doctor to go with. And I tell them, a doctor who listens to you, a doctor is going to be your best friend for life. You're going to see your doctor more frequently than your best friend. You're going to see me for life. So go with a doctor who can actually understand you, and you should not feel scared for asking questions and not feel rushed. And I tell my patients all the time, do not go on Google. I don't mind. Sometimes I'm sitting in my room and they have this huge paper and they have this huge diary and a lot of papers with 100 questions. I was like, no, I'm not getting frustrated. Ask me, because this makes me happy that at least you're not going on Google. I don't want you to go on Google. So yeah.
True. Love it, doc. Love it. I don't know. I feel like, yeah. You've exhausted every question. I was jotting them down and you were answering them as I was jotting them down. I was like, oh, doc is reading my mind. What is happening right now? But yeah, I think we've addressed, we've checked out every question. Yeah. But yeah, I feel like my takeaway here is just be an advocate for your own body. Don't be afraid of the doctor. Regularly reg. So don't be afraid. And cancer is controllable. We've just heard of somebody here who was on stage 4, but then she's living her life just like you and I. So it's not really a thingy. Also, eat healthy, avoid radiation as much as possible, because you cannot, truly speaking, you cannot eradicate it, but just control it, avoid it where you can, and just live life, man. Life is is there to be lived. So I don't know, doc, any last words, anything you want to say, any additions, advertise yourself, just anything now, just summarize anything you want to say before you say our goodbyes.
So I'm here, and yeah, I do specialize people who joined. I'm a medical oncologist. My name is Dr. Dawar. You can search my name on TikTok. I joined TikTok 2 weeks ago. I'm not TikTok savvy. I'm not Insta savvy at all. The reason I joined TikTok only a few weeks ago was because I see so much of misinformation circulating around here in outside in our world on Google, on TikTok, patients TikToking and Googling our symptoms and being afraid, and so much of misinformation, which is so scary. So I want to come out there and help patients and help you, not just patients like you or your loved ones or your families who has been affected by cancer or not affected by cancer. If you just want to learn honest, real information, real evidence-based information. So I'm here on TikTok if you want to follow me. My name is Richa Dawar and my name is Breast and Lung MD. I do specialize in breast and lung cancer, but I am a medical oncologist and I'm always believe in educating for my patients. I believe in healthy mindset. I believe in healthy living. I'm a mom of 2 boys who keep me busy all the time. And I do understand how busy we all are as a woman, taking care of everybody, right? Our husbands, our partners, our kids, our pets, our house. But we forget taking care of ourselves. We forget that. So it's very important that we need to talk about our health, important, and screening is very important for everybody. So if you're 40 or above, and if you're listening to this, and if you haven't gone to a mammogram, and if you're scared what to expect, what to do in a mammogram, reach out. I'm happy to help you.
Love it, Doc. Sorry, Doc, before we say our goodbyes, I can't ignore this anymore. Everybody is talking about food here. Everybody's focusing on food. A lot of
Yeah.
people fail to be disciplined with food, hence the sickness. I don't know, Doc. Do you think maybe it's more of the food than the radiation, your Wi-Fi, your TV, and all of that? Is it most of the food?
I will say radiation. See, we cannot avoid that, and that's such a low dose radiation that we face in everyday world. So definitely, we cannot link that. High dose of radiation does have caused cancers. Like lung cancer. Lung cancer happens in non-smokers as well, and people who have been exposed to radiation close to the factories, right? They will have increased risk of cancer, but not everyday radiation that we've been exposed to. Food plays a very important role, but everybody who's commenting here on food, I want to tell you that do not blame food for everything. I believe that with whatever intention you eat your food, the food is going to do that. I was born in India, so I'm Hindu. And in our religion, spiritual world, we believe that when you have your food in front of you, you have to thank God to give this food, that food was on your table. And then you eat that food, eat with a good intention that this food is going to go into my body and heal me. So, guys, we cannot just stay away from food. We cannot stay away from junk food. I love my pizzas. I love my hamburgers. I eat it. Yeah, it's okay. It's fine. So, but just live a conscious life. Like whatever you are eating, putting inside your body needs to be healthy, but we cannot stop eating. But you cannot blame everything on food. As I have mentioned before, I have many patients who eat healthy and they still got cancer. So, yeah.
No, I hear you, Doc. I hear you, Doc. It's all about consciousness. It's all about, just like we said, the mindset. Everything, it rolls back to the mindset. What are you thinking? What are your beliefs? Yes, Siafela. Yes, talk to your food. Whenever you're preparing your food, talk to it. Food, you are going to do this in my body. You are going to heal any ailments, manifested or non-manifested. What? Just speak. Be conscious, be conscious, be conscious. Doc, I loved this. I love it. You laid everything out in layman's term. I understood. My notebook is full. Thank you, Doc. Truly appreciate it. Everybody, please follow Dr. Richa Dawar. If you have any follow-up questions or anything, she's here for you guys. Otherwise, from me and Dr. Richa, bye, everybody.
Bye. Thank you. Bye.